Excellent. So we're going to talk a little bit today about grief and loss and dementia care. And I am grateful to everybody who's here today because this is certainly the other end of the spectrum from our usual conversations about hard science and data. So thank you to everyone who's willing to learn about something that obviously affects a lot of our family members, a lot of our patients, and a lot of the people that we are researching and working to ultimately serve. And hopefully, no matter where you come at issues related to aging and loss, that you'll find something that'll be helpful for you either in your professional or in your personal life. So in terms of my disclosures, you'll see I'm funded through the through the ADRC and the research grant, the program project grant. I also serve as a volunteer for the Alzheimer's Association through their Speakers Bureau, also as a support group facilitator. And then I'm also partially funded through the University of Missouri School of Medicine's telehealth, the Missouri Telehealth Network, and specifically through their Dementia Echo Hub team. Which, if anybody, by the way, is ever interested in learning more about the Echo, please let me know. Some questions to consider during our program today. First, what are bereavement, age and grief? What makes dementia different? What is the grieving process? How do we cope? And then how do we support individuals who might be grieving? So first, just to kind of get on the same page with some of our definitions, first we want to talk about bereavement. And we know that that's the experience of losing someone who is important to us. So it's kind of a state where we are experiencing loss when we have lost somebody close to us that has died, or it's a period of grief and mourning after a death. And when you grieve, it's a normal part of the process of reacting to a loss. So bereavement itself is kind of that period of time when you maybe are freshly experiencing a loss for whatever reason. If we think a little bit more about grief, I'm going to come down here just a little bit so we can see that. Grief is more of a feeling. It is that anguish that somebody experiences after their significant loss. Typically, we associate it with death, but that might not always be the case. It's considered an acute pain that accompanies loss because it's a reflection of what we love, and it can feel all-encompassing. And then finally, it is a strong and sometimes overwhelming emotion for people, regardless of whether their sadness comes from the loss of a loved one, from a terminal diagnosis, and it might be something that concerns themselves or somebody that is close to an individual. And then finally, mourning. And mourning is kind of our verb portion of this. It's when we're demonstrating the grief that we feel during that time when we've experienced a loss, or after that time we've experienced a loss. It's engaging in the act of sorrowing, expressing, feeling sorrow, and it's outwardly expressing or sharing of our grief. So that's the thing that we might see most often among our friends, among our family members, or our patients when they are actively expressing the emotions that come along with mourning. And in terms of grief, there's no specific single time that individuals might experience grief. We know that oftentimes it accompanies a specific loss. So that might be the loss of an important relationship or person, whether that's by, a broken relationship, by a death, any sort of reason somebody might lose an important relationship. We know that there's sometimes small and large losses along our way in life, and it can be hoping for all the way to something as dramatic as, losing your home, losing your job, losing someone beloved to you. And then we can also support the loss of less tangible things, the loss of support, of partnership, of companionship, of fidelity, some sort of value that we might hold dear to us that isn't something necessarily as tangible as a person or a thing. We also know that we grieve as we anticipate losses. So we might be experiencing compounded grief through a compilation of smaller losses and subtractions. We might grieve the loss of our future plans or our future dreams. We know that it's inevitable with Alzheimer's disease that we experience a lot of incremental changes to both our day-to-day reality and our future. And accompanying that is bereavement and loss. And then, of course, as we anticipate an inevitable final loss, oftentimes we might see this with a chronic illness, a protracted, stressful situation where outcomes, but we continue to grieve, not just at the culmination of that experience, but throughout that protracted process. One of the harder things for people to understand is the idea of ambiguous loss. And that's kind of a psychological loss, not necessarily a physical or tangible loss. And sometimes it's complicated. It might be complicated by hope or by improvements in somebody's condition or by gains in certain areas. So it's not always the kind of thing that can be understood by friends or family members because it's hard to describe. It's hard to see and share with others. It can be cumulative, small separations, small amounts of change over time that begin to continually stack up and affect somebody. And it's hard to resolve because sometimes it's difficult to even quantify, put a finger on, identify. And a lot of times people might, feel depressed or express that they feel anxious or blue or not like themselves, but not even really be able to put their finger on what it is that's causing these changes or these emotional feelings for them. And so in that way, grief is not always obvious to the people around us or even to ourselves when we're dealing with something that's more diffuse. And then obviously we know we grieve when we experience a life-altering change because grief is our time to accept our new reality and adjust to whatever our new future is presenting us and whatever dreams or hopes or experiences or goals may have been left behind. So we do know that when it comes to Alzheimer's disease and dementia, that both care partners and patients grieve. And in a lot of ways, some of the things they're grieving are are similar. Some of them are, very, very different as the disease progresses. Sometimes it's simple and upfront, and other times, again, it's that cumulative, ambiguous type of loss that's harder to experience and to quantify. And this particular presentation came about during a support group meeting. The night ADRC, very graciously, Dr. Morris allows us to have some support groups that are providing direct service to research participants, care partners, people affected by the disease. And during one of our caregiver groups, a woman said, "I can't tell you the last time I felt joy." And that was a really interesting statement to make because, we don't really think about where are we finding joy? How do we find joy? And in dealing with a diagnosis that is as, obviously progressive and as devastating to families, we don't often think about, we think about coping, but we don't always think about improvement or joy or helping out in this situation. So it can be challenging for people. So we do know that both parties are grieving at diagnosis, throughout the progression, and at the end of life. And people are definitely grieving tangible losses, the loss of skills, abilities, knowledge, that ability of being able to express and show what they want, what they need, what their preferences are, and kind of the dignity that goes along with that expression of our needs and wants. And people are also experiencing personality changes, memories that are lost, changes in relationships. So actual changes that are interfering with somebody's quality of life, with the quality of their relationships, and their overall life satisfaction leads a lot to grief. And then there's also some of these intangible losses that are probably more difficult to explain. The loss of identity, who you were as a person. If you were always the patriarch of the family and the one to keep all the ducks in a row and suddenly you are unable to function at that level, there's going to be a lot of confusion and grief about that loss of esteem among your families, that loss of competence. Loss of safety, and that might be your physical safety, your emotional safety, even possibly your emotional well-being as somebody transitions through this disease, or as a care partner transitions through this disease. Their formerly very loving and affectionate care partner might become emotionally abusive or physically aggressive, and they can be grieving that loss of that safety and security and quality relationship. We know that often there's a loss of autonomy that might sneak up at tiny increments, such as losing the ability to be independent and manage your own activities, the ability to drive safely, the ability to go out and walk and navigate your neighborhood or to do things on your own. And then probably one of the biggest ones that we hear about is the loss of future dreams and expectations. We all work our lives and pick our partners and go on and, have families with the goal that eventually we'll have retirement or we'll have travel or we'll have grandchildren. And a lot of times people have to deal with the very real reality that those things may not happen for them, or they may not look the way they thought that they would. And even though it's not something as final as death or someone passing away, those are very real things that have changed and gone away that people actively grieve throughout this disease. So to think a little bit about what grief feels like. We know that grief feels like a lot of these very devastating emotions: sadness, depression, isolation. People oftentimes feel angry, fearful, worried, exhausted, overwhelmed, helplessness, yearning for whatever their future was supposed to look like, denial that this is the path that they're on with their partner, shock and numbness, possibly after receiving a diagnosis or perhaps accepting the diagnosis and it can no longer be denied. But the tricky thing about grief is that it's not just that easy. Grief comes with a lot of conflicting feelings as well. And sometimes that might include gratitude when somebody who has a very debilitating illness ultimately passes away, and we feel glad that maybe they're not suffering anymore, or realization that's not how they would have liked to live their life. Relief. Oftentimes people might feel resentment. It's hard to be in your 70s, 80s, or older, to be frail, potentially not in your top shape physically or mentally, and be caregiving for someone. People did not often sign up for that. But then again, we remember sickness and health, and sometimes we feel shame for feeling that resentment, for feeling that anger at our loved one. And that adds a lot more complex emotion, because not only are you feeling loss, but now you're feeling guilt and shame and confusion on top of it. And we also know that as grief starts to transition more towards, someone being able to move on, we know that healing starts to begin as well. And healing can happen at many different stages during a dementia progression. Maybe that happens when somebody transitions into a living community, or maybe it happens when someone loses the ability to be mobile. And so that fear of them wandering or becoming injured goes away. So there's little stages along the way that might bring healing, even though someone is still on their grief trajectory. But what we do know is that the therapeutic purpose that grief serves for us and mourning serves for us is to get each of us to a place where we can learn to live with loss and do so in a healthy way. So it's not, affecting our activities, our mental abilities every day. It's not affecting our physical and overall health. And probably one of the biggest things that I think can be, I hope folks take away from today, is that there is no single type of way to grieve. There's no single correct way to grieve. There's no set time frame on that. There's no forward trajectory. It's a series of stops and starts and reverses, and every single person is going to go about that the best way that they are able to do so. So in terms of why we grieve, I think it's interesting because, as a society, we've been losing our loved ones for thousands upon thousands of years. And even despite that, we are no better in dealing with death as a society than truly, maybe they were 100 or 200 years ago. And death is considered to be quite a bit of a paradox, because it's something that every single one of us will experience, yet no single one of us is able to discuss that experience, talk about it, or share, because it is a final experience that we go through. So why do we grieve, given some of those different parameters? The first is that evolutionarily, we are hardwired for our own survival to form bonds with individuals. Those that are left to their own in the wild are not going to last very long. So those communities and connections that we make are not just for our emotional well-being, but for our actual safety. And even though we're not all, living in the tundra and fighting off predators, we still very much are hardwired to form those familial and community bonds. Physiologically, there are chemical changes in our brain that are wired to, our relationships. Relationships, especially positive ones, affect the portions of our brain that lead to oxytocin and dopamine. And those are the hormones and chemicals that make us feel good, and we want more of those. And when those particular bonds that stimulate makes us want those things that originally created them. It makes us want that relationship back. We want that loved one back in our life, or that partner who, broke up with us to come back. And so, we want to recapture those feelings. Emotionally, grieving requires us to rework how we think about ourselves and think about our life so that we can learn to live in the world that we're in now, in this new reality. And we also have to learn to be a person who carries absence, because this isn't something that goes away. This becomes a permanent part of ourselves and a permanent part of the way we navigate relationships and, a new world without our partner. And then practically, we have to start to make specific adjustments for how we move forward, accepting and adapting to all the tiny little habits and predictions and things around the home and things in the workforce that we have to learn to do in a new way. And so, grief can't just exist in a bubble. It affects everything from our atmosphere to our relationships to our mental functioning to our job performance. And being able to address and understand these little portions are what makes people able to come out the other side of grieving and be able to handle that loss. So in terms of dementia, we do know that grieving as it relates to dementia can be very different than a lot of other diseases. The first is because the losses are gradual and they're plentiful. I'm sure many of you have heard the description of Alzheimer's disease as death by 1,000 subtractions. And each one of those losses brings grief and sadness to the individual who's no longer able to perform as they might like to, or the spouse who's no longer able to be there for their partner as they might like to. The disease has a very long trajectory. We know it can be anywhere from 8 to 20 years on the long end. And so we know it's a very long trajectory with an unpredictable path. And that path leads to hope occasionally, uncertainty, or possibly denial about what's going on. And all of those can complicate someone's forward progression through grieving. Dementia care, we know, is physically, mentally, and emotionally overwhelming. It can lead to resentment, those hurtful emotions that we discussed, and being mired in those kind of feelings might stunt somebody's ability to go through their grieving process. Sometimes it's just confusing. People might not understand the reality of grieving someone who is still with you, and instead grieving someone who has lost certain skills or lost certain personality traits that made them so important to you. And so oftentimes when people talk about how hard it is to be a care partner with this disease, people might not understand, because they'll say, well, why are you grieving? He's still alive. He's still with you. But they might not understand the depth of change in a relationship because of all these little deficits that have stacked up over time. People often don't see those losses and they don't understand, especially if somebody doesn't have a lot of exposure to an individual with dementia. They may not truly understand the depth of deficiency somebody's having, just how progressed their dementia might be. We always underestimate just how well someone can participate in conversations and, very basic social interactions. So sometimes it's easy for people to come away from that and think, oh, they're fine. I don't know what she's so worried about. She's just being an alarmist. When in reality, there are big differences that somebody is seeing and is grieving. We know that this protracted disease leads to extensive periods of grief, and those periods will start and stop, and you'll gain a little bit and you'll lose a little bit. But at the end of the day, there's no time to linger in the grief. There's no time to reconcile it, because the show has to go on. A person still needs their support. They still need to buck up and get the job done when it comes to being a care partner. And that is very difficult when it comes to managing both the needs of your loved one, but also attending to your own physical and emotional needs as well. So the Alzheimer's Association did some really good work identifying things that are common in the grieving process. And what you'll notice as we go through these is there are 5 characteristics that are heavily derived from Elizabeth Kubler-Ross's 5 stages of grief. The interesting change here is that the Alzheimer's Association has kind of aimed these more at the care partner, whereas the Kubler-Ross stages were specifically aimed at a person who had received a diagnosis not necessarily Alzheimer's disease, but whatever particular illness they were dealing with. So the first in this, obviously, is denial. So I think this really underscores the fact that research shows us that the average individual with Alzheimer's disease typically goes about 3 years of showing symptoms before they ultimately go to their doctor and receive a diagnosis. And during those 3 years, that's typically a lot of this denial process, hoping that their loved one is not ill, procrastinating on that medical care or going to get a diagnosis. Maybe just expecting the person to get better, oh, they're just depressed. Oh, it's just, winter sadness. Oh, it's because our son moved out of the home. People might justify these changes and expect the person to get better. Convincing yourself that the person has not changed. We hear this quite a bit. Oftentimes, it might be an adult child who goes home over Thanksgiving and says, I talk to dad every week, and I was shocked over Thanksgiving when he could not even navigate around the home safely. And so, convincing yourself through limited interactions that maybe a person is fine, only to be really surprised with it later. Normalizing those problematic behaviors. We often hear sometimes in this work, well, that's a normal part of aging. That happens to everybody. But we do know that that is not the case when it comes to dementia. And then denial, repressing the diagnosis, not telling other people, and really kind of keeping it private and kind of closing the wagons and not letting people be a part of supporting the new dynamic. Anger, of course, becomes close on the heels of that denial. And as care partners, it's very common to feel frustrated with the person, resent the demands of caregiving. It's not just sometimes we might resent the individual patient or our loved one, but resent even being in this position at all. I didn't work 50 years as a nurse and ultimately retire so I could come home and, nurse my ill partner, and that might look different across any different spectrum. And you might think, oh, that's a really horrible way to look at it, or that's a terrible way to think about your partner. But just because they're not glamorous or, gracious feelings doesn't mean that they don't exist. And the shame someone feels as a result of feeling that way just compounds the grief that they're feeling. People might also resent family members who cannot or will not help to provide care, feeling cheated out of the future that you had worked so hard or that you had anticipated. And then feeling abandoned that, now we're here together, our partnership, we plan to live our life together, and I have to figure out how to go on without you. And that is something that brings a lot of sadness and brings a lot of anger. Sometimes we find that people experience anger because it's easier to experience anger than it is to open yourself up to the vulnerability of experiencing grief or sadness or need. So a lot of times people might get stuck in anger because in some ways it's a lot safer than the vulnerability of some of those other feelings. Oftentimes there's a lot of guilt. And people might have unrealistic expectations. Why didn't I do this when I had the chance or when she was healthy? I should have done this better. Why do I have to do everything for her? Or, my loved ones in a community, I have to visit every day, or I'm a terrible wife. And so there's a lot of conflicting feelings about caregiving, that you're not doing it right or doing well enough or, working hard enough, which is a really unrealistic standard to hold ourselves to. Feeling bad because you are still alive and able-bodied and can still go about and have joy in your day-to-day life. Feeling that you failed, individuals who ultimately engage a care facility or someone to help support their care partner often feel like a failure, and they feel a lot of grief related to that they couldn't do the job right, or they couldn't do it alone, or they let their loved one down. And unfortunately, sometimes it's for the safety and health of both the care partner and the patient to seek the kind of resources that are provided in these care communities. Sometimes people might not want or be unable to perform parts of caregiving, and that can be challenging. For example, adult children who might be reticent to provide for their parents' hygiene needs, their bathing, their toileting. And sometimes people just, adult children might not want to see their parent in that light. A spouse might not want to see their partner as someone who has to have those needs managed. And that's an okay and reasonable feeling to have, but sometimes people will feel some guilt about that. Having negative thoughts about the person, wishing they would go away, wishing they would die. Again, normal reason feelings as someone copes, but unfortunately, there's a lot of guilt and sadness accompanying that. People will say, what kind of person am I that I'm just thinking, I wish they would die, when that individual spouse might know, this isn't how my husband would have wanted to live his life. This isn't what he wants for himself. And then finally, regretting things about your relationship before the diagnosis. And that can be common among adult children who maybe didn't have positive relationships with their parents, or spouses that might potentially have had contentious relationships. Sadness, obviously feelings of overwhelm, crying, withdrawal from social activities, or the converse of that, needing to connect more frequently with others. And then again, withholding emotions or displaying them more frequently. And what we notice about these is that there's just no set way to do this. If you see someone who requires a lot more support and is needy, that's just as valid of a coping strategy as people who withdraw and don't want to be with their loved ones. And so sometimes people might not understand a grieving process because it doesn't look like anybody else's or something that they've seen before. And then finally, as we start to get to a better place within our grief journey, we try and hope that we'll see some acceptance. And that's ideally where a patient and a care partner can live in the moment, find personal meaning in the journey of caregiving for somebody who's terminally ill. Understanding you might not have wanted to do it, you might not be very good at it, but you're trying your hardest. And this is a labor of love that you're giving to someone you care about. Understanding how the grieving process affects your life. We always hope that people have emotional support as they go about these kinds of changes in their life, and having some insight into grief and understanding all these different ways that it might pop up and recede and come back again can help somebody understand the feelings they're experiencing. It's good and okay to appreciate the personal growth that comes from surviving loss and being able to have the pride of coming out the other side, knowing that you managed these changes and you managed this and are stronger by virtue of having completed caregiving or experiencing loss. Finding your sense of humor is huge. We often tell people in support groups, if you are not laughing in your support group, then you need to find another group, because we know this is an awful disease. We know it is demanding and depressing, and it can be challenging and awful. But we can't live in those feelings all the time. We have to have ways to find joy, to find humor, to let off steam, to connect with others. Otherwise, we're not really going to be able to make it through this. And then finally, and shockingly, one of the most difficult for people is asking for and accepting help from others. We have so much stigma around asking for support in our society. We feel like we should be able to accomplish things ourselves. And if we need help, then we are somehow deficit as people or planners or leaders. And we really do need to move away from that thought, because, just like we are hardwired genetically to live in groups for our own protection, we need to be able to see the converse of that we should be able to accept support and accept care from the group, again, for our survival and our ability to be healthy. So just a few last things I want to share. First, how do we cope with grief? How do we recommend to our loved ones, our patients, or individuals, that are experiencing grief? What do we hope for them? The first is to face those feelings. Don't repress them. Don't push them to the side. Don't think you'll deal with them once your loved one dies, because those are very real and present feelings today. Identify those, put a name to those feelings and the cause. Prepare to experience feelings of loss multiple times, maybe even about the same thing multiple times. Claim the grieving process as your own. Don't feel like you have to put on a certain happy face or that you have to minimize what's going on, because only through talking about this can we kind of destigmatize some of the trajectory and what we experience with an Alzheimer's diagnosis. Make sure you're talking with someone, whether it's, regular meetings with a close friend, a confidant, a therapist. If you're someone who chooses to process things through journaling or, writing, consider doing that regularly. Combat any feelings you might have to self-isolate, because that will only increase, those feelings of isolation and loneliness. So definitely try to steer away from that. Know that some people will not understand your grief. People who maybe have not seen your loved one in a long time, or maybe who aren't as aware of the changes that can accompany Alzheimer's or related dementia, they might not understand. You might get the very perfunctory, well, I just saw them at church, everything seemed fine. When really, they saw an individual sitting in a pew and didn't have any interaction or any depth to really understand what's going on. So don't let them minimize what you're experiencing. Accept yourself, accept that you are doing the best you can with the resources you have at any given time, and give yourself the grace to accept that. And then give yourself permission to not always be grieving. Give yourself the permission to go out to dinner with a friend and leave the grief at home, leave the burden of caregiving alone, leave all of those negative feelings behind, so that you can nourish those emotional parts of yourself that need to stay healthy as you go through this care partner journey. We always encourage people that when it comes to a very long disease like Alzheimer's, there are small positives along the way. First, it gives individuals time to plan and set the direction for how they would like to see their end of life decisions made, whether that's financial, legal, their living situations, their medications, their advanced directives. Do those bucket list items as soon as possible. Retirement might not look exactly as somebody planned, but it can still have shades of what was originally planned, and especially early on in the disease. Say those things that need to be said. We sometimes can assume that care partners are there voluntarily for their loved one, but we do know that sometimes adult children are in the position of caring for someone who never cared for them, or, caring for someone who's always had a very difficult personality, and it's been a rocky relationship. Use this time to right longstanding wrongs, say what needs to be said, and try to get as much, I don't even want to say closure because that's not accurate, but get to as satisfactorily of a place as possible when it comes to getting all the cards on the table. Reconcile those complex relationships and celebrate the life that's lived. There is still a lot that can be honored about the patient, the individual who has the diagnosis, and this is that window of time to do it before things start to, result in more significant memory and thinking impairment. In terms of how to help a grieving caregiver, the first is listen. Just listen without judgment. Allow them to say what they would like to say. Meet them where they are in terms of hearing the message and understanding that they're doing the best that they can. Ask questions. Let them know you hear them, that you see them. Is there something you can do? Is there some way that you can help? Don't judge. Don't, criticize, because that doesn't do anybody any good. Share memories of the loved one that, of good times before there was disability, before somebody was experiencing chronic illness. Don't pretend to have all the answers, because none of us do. We don't know the individual idiosyncrasies of any caregiving relationship. And so pretending to have answers can sometimes lead to more frustration than it alleviates. Acknowledge the depth of the loss. We know that the losses with Alzheimer's don't just come when somebody dies. So acknowledging those little changes along the way can really help a care partner be seen. Avoid platitudes. And I think by this point in all of our lives, we probably know that it is what it is, and that everything happens for a reason, and she's in a better place now. Don't do anybody any good. So avoid them. It's okay to look at somebody and say, I don't know what to say right now, and I don't know what it is that you're going through, but I'm here to listen, and I'm happy to do anything I can to help you. And that's okay. It's okay to not have the answers or to know exactly what to do. But just admitting that without substituting in any of those other kind of cheesy things can go a long way towards supporting someone. Remember that grief isn't linear and it's not logical. Don't advocate for closure. And I think this is a really big one, because we're not wanting to close that door and just move forward in a new reality. What we're looking for instead is acceptance of that grief, acceptance of those losses, and being able to integrate those into our day-to-day life and move forward in a productive way. And then again, lean into absurdity. It's okay to laugh. It's healthy to laugh. And it's not disrespecting your loved one. It's not, diminishing their, autonomy or who they are as a person. It's okay sometimes to find the things that are laughable about dementia in that, because we can't spend our time frustrated and despondent all the time. I did want to share some resources and support, and if anybody is interested in a hard copy of these, certainly I'm happy to provide those for you. You can contact Emma or you can reach out to me. Washington University, for example, has employee assistance programs. If you're interested in reaching out for emotional or counseling support, a lot of other employers have those services as well. We always encourage the use of support groups, and there's many available across many different diseases, many other conditions. There are wonderful grief websites. The Canadian Virtual Hospice is outstanding. That's at mygrief.ca. And I really found that they have some impressive philosophies, and they also have some really good tangible tools that individuals can work through. So I recommend that. And then again, just thinking about places where grieving individuals might congregate, such as within hospice and palliative care organizations, bereaved organizations. And then also just bearing in mind that it's not just adults that grieve, but children often have their own grief needs as well, which can be a lot different. They're newer to some of these conflicting emotions, and there's support at Fernside, childrengrieve.org. And then if you are somebody who is very, very drastically experiencing extreme guilt and, depression, you can contact the 1-800-273-8255 suicide prevention line, or refer that out to somebody, just because we do know that, grief, overwhelming grief, can lead to feelings of self-harm. Some other resources real quick, books including Jolene Bracke's Creating Moments of Joy is just a really beautiful way to think about going through the care partner journey and how to live each moment in the day by providing joyful experiences and minimizing deficits while maximizing the things that someone can still do. Ambiguous Loss by Pauline Boss, and she also has a website listed there, is a great resource for how you navigate through these intangible losses. And then somebody in one of our talks actually recommended When Reasoning No Longer Works, a practical guide for caregivers dealing with dementia and Alzheimer's. So definitely check that out. And then finally, because this particular presentation is aimed at individuals, maybe who are at the caregiver level or kind of, more involved at service and support, there's some really great podcasts out there that are aimed at a lay audience. The Paradox of Grief is one that people really rave about. Julia Samuel is a 30-year counselor who has supported people through their bereavement journeys. Terrible Thanks for Asking is kind of a serious kind of comedy. It's got a little bit of both, by Nora McTierney, and started with her own terminal cancer diagnosis and, her cancer diagnosis. She did manage to survive that. And just kind of prompted her to think about grieving and how people address that in a different way. And then NPR has Grief for Beginners, 5 Things to Know About Processing Loss, and that is part of their Toolkit for Life series. They have those in different areas if you want to be working through different skill sets in your life. And then finally, the Bereavement Room. And that one is neat because it kind of looks at grieving and loss across the different diasporas in our culture. So it's not just looking at it from your perspective, but how do other nationalities, how do other ethnicities view grief, and how can we provide support for them that's meaningful? So just to wrap up, I did want to acknowledge Dr. Morris for allowing the ORCOR to do this work that is in service of people who are affected by dementia and their care partners. My core leader, Andre Denny, who supports this work not just in her role as our core leader, but also as a social worker for the Memory Diagnostic Center. My former support group facilitator, Becky Fearberg, who partnered with me for 3.5 years leading support groups, and really much of what I know about supporting groups and helping people is by virtue of knowing Becky. And then finally, some people shown here in the picture, but members of our Night ADRC support groups. We have 2 support groups related to research participants, one for care partners, one for family members. or pardon me, one for care partners and one for patients. And then also people in our young onset groups. Again, one for care partners, one for patients. And I love this picture of them because they couldn't be just content to meet during their group meetings. They wanted to get together socially. So they have one member who drives through from Texas to make sure that he could be there when they meet. And you can look at this picture and not know who is it that has dementia? Who is it that's the care partner? Because in this moment, they're together, they're connected, they're happy, they're experiencing joy. And that's what we hope for everybody who is together. So I do have some time for questions. I have a couple little quotes here that I thought really were interesting and insightful ways to think about grief. But I really especially like this first one, that grief is your way of trying to keep the person who died in your life while trying to build a new life without them. And I just thought that's a neat way to think about moving forward and not being stopped by the grief that we experience. So I'm going to stop the share